Hello, my name is Ian Ney, and I am a student physical therapist in the Regis University class of 2021. Today I'll be examining the effect of wrist position on length-tension relationships. In layman's terms, this means if the muscle is shortened or lengthened, how much force can it generate? As physical therapists in the clinic, it is vital that we understand this relationship. As we know, wrist strength can be impacted post-injury and post-surgery. The measurement of hand grip strength has been used in clinical settings to determine the degree of disability and how quickly our patients are progressing in their rehab. As Bersons et al. Stated in their article, wrist position has been shown to impact the load transfer on the flexor group and could cause early rupture in sutured tendons after surgical repair, but which position is actually unclear, leaving room for more research. This brings me to the purpose of my study. Purpose was to determine whether a change in wrist position and/or the hand grip dynamometer setting can impact wrist muscle performance as measured by EMG. I hypothesize that the strongest muscle performance will be assessed in a neutral position at standard grip length rather than any other condition. Now, who actually participated in this study? 8 subjects volunteered for the study. 50% were female, while 50% were male. There was a mean age of 26.5 years, plus or minus a standard deviation of 4.84. Subjects were included if they were members of the Regis DPT class of 2021, they had the ability to hold a hand grip dynamometer for a long time, and to sit comfortably in the testing position. They were excluded if they had pain or illness affecting the wrist, or latex or adhesive sensitivity. Now, how was the study actually performed? As you can see in the pictures, participants' arms were prepped using a razor and alcohol swab to ensure proper adhesion of the electrodes. One pair of electrodes was placed on the muscle belly of the wrist extensor group and one pair on the muscle bellies of the wrist flexor group. 2 additional electrodes were placed on muscles not being measured as the grounds. They were instructed to sit in a standardized testing position, as you can see detailed under the right side of the methods column. Subjects then executed a maximal hand grip test to assess their baseline values of peak grip force measured in kilograms and peak EMG in both the flexor and extensor group. The following conditions were then applied to the tests: grip of the shortest setting, grip of the longest setting, wrist and maximal extension, and wrist and maximal flexion. To analyze the data, mean and standard deviations for each condition were calculated and analyzed to the baseline measurements. Now, what were the results of the study? As you can see in the graphs, the normalized standard position was normalized to 100%, and everything else was compared to that value. In mean peak force production, every condition was lower than the standard position, meaning that the muscles could not generate as much force as they could in the standard position. In the extensor group EMG mean peak, these conditions also apply. The extensor groups were not able to generate as much EMG activity as they were in the standard position. However, this condition does not apply for the flexor group. As you can see, the short grip actually generated a little bit more EMG activity in the flexor group than the standard position. This may have been due to an error in the arm measurement, or the placement of the arm, or even researcher error. The other conditions did follow the trend, however. Now, why is this important? What are the conclusions that we can make? Well, wrist flexion and extension result in less optimal length of the muscle, which impair the grip force production. So the muscle spindles are not as long as they need to be, or as short as they need to be to create maximal force. The positions that reduce the maximum voluntary contraction of the wrist muscles should be accounted for when using post-op orthosis. My hypothesis was supported in all conditions except for that one short grip condition in the flexor group EMG activity. Now, why are these findings relevant to the clinic? Well, as you can see, the length-tension relationships of the muscle groups is vital for designing treatment for wrist injuries. Every patient is different, and every patient should have a treatment designed around them. Orthoses embraces to reduce the maximum voluntary contraction of wrist flexors and extensors to decrease the risk of re-injury. Patients should also be informed as to which wrist position is most comfortable if they're experiencing pain while moving and contracting their wrist. And thank you for your time. Once again, my name is Ian Ney, and I'm a student physical therapist in Regis University class of 2021.